The dangers of fish consumption. Seafood is identified as the leading cause of all foodborne illnesses in the US each year. Seafood is one of the most common causes of food allergies worldwide, often with life-threatening acute reactions and lifelong chronic effects.
Ciguatera poisoning, the most common seafood toxin reported worldwide, found in over 400 fish species, including farmed salmon. The tasteless, odorless toxin cannot be destroyed by cooking or freezing, and once ingested, there is no cure. Some symptoms: nausea, vomiting, nightmares, insomnia, dangerously slow heart rate, abnormally low blood pressure, and nervous system dysfunctions such as prickling and numbness of skin, weakening of respiratory muscles, coma, convulsions, blurred vision, transient blindness, hypersalivation, inability to swallow, the sensation as if teeth are about to fall out, and false temperature perception, in which hot objects feel cold and cold objects burn. Symptoms can last for years and relapses occur by consuming seafood, chicken, pork, coffee, or alcohol. In 2009, Tom Pickett, an active diver and surfer, caught and ate a tropical fish containing ciguatoxin. He was hospitalized for over 2 months, at times unable to talk, walk, or feed himself, and lost 50 pounds. Once out of the hospital, Tom suffered daily from fatigue, unclear thinking, unintelligible speech, hallucinations and delusions, difficulty in tasks like showering and shaving, and the constant risk of falling and injuring himself.
Scombroid poisoning. Some symptoms: burning sensations around the mouth, facial flushing, sweating, nausea, vomiting, headache, palpitations, abnormal heartbeat, dizziness, rash, and vasodilatory shock. Scombroid toxin cannot be destroyed by cooking or freezing. Within 30 minutes of eating a canned tuna salad, a 51-year-old female physician experienced a throbbing headache worse than her usual migraines, with nausea, abnormal heartbeat, and the feeling of impending doom. She was later diagnosed with scombroid poisoning.
Tetrodotoxin, fugu, pufferfish poisoning. Some symptoms: victims remain fully conscious while becoming completely paralyzed, thus imprisoned within their own bodies. The toxin in one pufferfish could kill 30 adult humans and has no known antidote. Pufferfish toxin cannot be destroyed by cooking or freezing. Japanese kabuki actor Bando Mitsugoro VIII died of paralysis 8 hours after eating pufferfish livers.
Shellfish poisoning. These toxins cannot be destroyed by cooking or freezing, and there is no known antidote. Types include paralytic shellfish poisoning, neurotoxic shellfish poisoning, diuretic shellfish poisoning, azisparicid shellfish poisoning, amnesic shellfish poisoning. In June 2010, 57-year-old John Saunders from the US died within 3 days of eating crab. The toxin, known to be 1,000 times more deadly than cyanide, at first tingled his lips, then weakened his muscles, impaired his coordination, and paralyzed his body so that he could barely breathe. He succumbed on the day after leaving the hospital. His death was the area's second fatality in less than a week, due to paralytic shellfish poisoning.
Mercury poisoning. Mercury poisoning is caused almost exclusively by eating fish. Some symptoms in adults: visual field constriction, memory loss, headaches, tremors, loss of fine motor control, spasticity, hair loss, and prickling of hands, feet, and lips. Some symptoms in infants: unborn infants exposed to mercury from their mothers can suffer blindness and deafness, cerebral palsy, mental retardation, seizures, swallowing and speech problems, and other birth defects. Mercury contamination in fish led to a poisoning outbreak affecting 2 million people in Minamata, Japan, starting in 1956, causing more than 900 people to lose their lives and thousands to suffer seizures, paralysis, and permanent severe neurological damage to limbs, speech, hearing, and vision, etc. Cats were seen having convulsions and drowning or running into flames. Crows fell from the sky, and dead fish floated on the sea. Sohachi Hamamoto, a hardy and strong-willed resident, overnight lost his balance while walking, could not put on his shoes, salivated, and began to convulse so much that he had to be tied to his bed. He craze danced like the cats and tore open his skin relentlessly with his fingernails, dying 7 weeks later. A U.S. study found that every fish tested across 291 streams was contaminated by mercury.
More types of seafood poisoning. Fish and shellfish accumulate and transmit pollution and toxins from the environment to humans, including polychlorinated biphenyls, PCBs, dioxins, banned insecticides, etc. Fish and shellfish frequently transmit deadly pathogens, including worms, hepatitis A virus, norovirus, Vibrio bacteria, Salmonella, E. coli, and Listeria. Researchers find that fish worldwide is contaminated with cancer-causing radioactive strontium-90, which may date back to global nuclear testing of the 1950s.
These are just a few of the facts and real cases of fish poisoning. There are many other heartrending cases which can't be all recounted in this limited time.